Good afternoon. My name is Carol Eisen. I am the Human Resources Director. Thank you, everybody, for joining us for the next in our series from the Department of Human Resources panels. May, as you know, is Mental Health Awareness Month, and never more than now do we need to pay attention to this month of May and all 12 months of the year in thinking about mental health awareness. To acknowledge and spread the word during Mental Health Awareness Month, we are partnering with our friends at the Health Services System to bring you information and resources about how you can prioritize your own mental health and your wellness for yourself, your families, your colleagues, and your communities. I don't have to say what a tough year it's been for all of us. COVID-19, the ongoing fight for racial justice, the violence we've seen, especially against our Black and Asian communities, the loss of loved ones, and the isolation that many of us have felt over the past year. It has been very challenging for all of us and for all of you, and we hope that you learn today from the content that we're about to present. We are going to focus on what we can all do to recognize the signs of stress and of anxiety, and to learn from experts in the field about the issues that they have come to see, both in their lives and through these virtual doors. To moderate today's panel, I would like to present to you Josephine Ayankoya. She is the Director of Race, Equity, and Inclusion at the San Francisco Municipal Transportation Agency. Ms. Ankoya is a master's in public health, and she's been with us in the city as a city employee since 2016. Thank you very much, Ms. Ankoya, and to all our panelists, and we look forward to hearing what you have to offer for us today.
So much, Carol, and greetings, everyone, and welcome to this panel event in recognition of Mental Health Awareness Month. As Carol shared, today's panelists will be providing information to share more resources and also tools that can support us all as we work to recognize signs of stress and anxiety. And also they'll be sharing information on different pathways to access different mental health or care resources. They'll also be talking generally about simple coping mechanisms that you might find helpful in your day-to-day lives. As Carol mentioned, my name is Josephine Ayankoya, and I work currently with SFMTA as the Race Equity Officer. And for the past 5 years prior to joining SFMTA, I worked with the Department of Public Health as a manager and a director doing mental health programs, housing programs, and also HIV programs. So I'm very excited to join our colleagues today from across different departments, DHR and HSS, and also to be moderating this amazing panel of experts. So now I'll introduce the panelists. There are a series of questions that have been curated based on feedback, and that will guide our discussion. So today's panelists include Jeff Littner, a senior employee assistance program counselor. Jeff started working in the mental health field in 1985 as a mental health counselor at a psychiatric hospital. Then he joined the city and county of San Francisco in 1992. He's worked with the city as both an EAP counselor, so employee assistance program counselor, and also a senior counselor. Jeff has specialized training in biofeedback, substance abuse, and mediation. He's passionate about helping employees and departments feel and function better. So we're really excited to hear about Jeff and hear from Jeff in our conversation. Mm-hmm. Our second panelist will be Dr. Gina Gregory Burns, an internal medicine physician. Dr. Gina Gregory Burns specializes in internal medicine and has practiced internal medicine as a physician at Kaiser Permanente in San Francisco for 31 years. Her passion is to deliver quality primary care and address health disparities for both English and Spanish-speaking patients. She is the co-lead for the Equity Task Force to improve operations by making Kaiser Permanente San Francisco Medical Center an anti-racist institution. We're really excited to hear from our provider network when we think about the different providers serving the city and county of San Francisco. And last but not least, we have Dr. Jewel Shim, a psychiatrist from Kaiser Permanente. Dr. Shim is a chief of psychiatry at Kaiser Permanente East Bay and an associate clinical professor of psychiatry at the University of San Francisco, California. Her area of specialty is medical psychiatry. employees. So we are really grateful to also hear from Dr. Shim. So the other side of the Bay, we have representation from Kaiser Permanente. And with this robust panel, we're hoping that the questions they speak to really get at some of the concerns that employees have raised. So as I mentioned, employees were asked to submit their questions for the panel. So if your question is not specifically addressed, DHR and HSS will share responses. So we're basically making sure that we have information and may not have your specific name worded, but we'll be sure to share responses and follow-up communication through the employee newsletter in the employee resources section. So we encourage you to use the chat feature to respond and to share information. But for today's conversation and for the limited time that we have, we'll be prioritizing information that was submitted. So for this first question, we're going to open this up for all panelists. So feel free for anyone to jump in first and then someone else can follow. The COVID-19 pandemic had a major effect on all of our lives and mental health. As healthcare professionals, how have you addressed the increased stress or anxiety in your own lives during this time?
I don't mind starting. Can you hear me?
Yes.
Okay, great, wonderful. I think it's very important to understand that all of this stress has affected us just like it's affected all of you. And so this is not just, some people are affected and some not. I think we really have to always think of everyone being affected, and nobody is immune from this is really important. I know at the beginning of the pandemic, I realized I had to put something in place for myself. I'm from New York, and when the pandemic was hitting hard in New York City, it was affecting a lot of the people who I love and have worked with. And so I really had to think, what can I do so that I can continue to take care of my family, take care of my patients in this very evolving and chaotic time. So I made sure that I started walking on a regular basis, which was probably more than I had been doing. Also, later this year, I've been using an exercise bike more often. I joined a mindfulness group online, so really being aware allowed me to kind of be present with what I was feeling and acknowledge the stress and not deny it or try to stuff it away. Go to counseling myself. Also offering grace to everyone, including myself. And I think, what does that mean? Grace means acknowledging or recognizing everybody's doing the best they can. So whether it's your family, your colleagues, your frontline staff, that you're working with and people seem like they're having a hard time, acknowledge that they really are trying the best they can. So avoiding criticizing or being critical of oneself and others. And certainly, this is all unprecedented time. And finding fulfillment in making a difference. I know for me, when I care for my family, we had a situation where, someone was in quarantine in my home, or caring for, folks far away during this time period on the phone. Caring for others makes me feel like I'm making a difference. At least I'm doing the best that I can.
Yeah, thank you. For myself, it's self-care, 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 self-care. And I appreciate what you were just mentioning, Dr. Gregory Burns, because that sense of grace and kind of allowance that everybody really is trying to do the best that they can. This is not the easiest environment. And for myself, again, trying to keep to a regular sleep schedule, making sure that I'm getting enough rest, which always matters to me. Eating well, in the beginning, it was so easy just because we're working from home at this moment, to go to the refrigerator, at lunchtime and go, oh, ice cream for lunch? Sure, why not? But not a good idea. And so swinging back around to trying my best to stay on a regular exercise schedule, I had actually bought myself a bike so that I could kind of ride around town. I seem to have collected that common COVID-10. I keep wanting to blame the dryer, but I don't think it's the dryer's fault. And so really it is just the self-care, manage my mood, make sure that I take time, limit really my exposure to kind of toxic TV, frankly, has been helpful for me as well. So I think it's a good question.
Yeah, so I would echo the comments of Mr. Lintner and Dr. Gregory Burns. I think similarly, I was really trying to promote my own wellness. I think, during this time as a provider, as a psychiatrist, actually, I am in the position to, offer comfort to others, and it has been a difficult time for everyone. And so it's really important to recharge myself and find ways to be resilient. So exercise, sleeping, very similar to the other panelists. The other thing I think was really important is to maintain social connection. So during this time, we've all been hunkering down in our homes. We've been virtual. We haven't had the same kind of social contacts we've had on a day-to-day basis with our colleagues and even with some of our families. And I think the tendency to isolate has been, pretty common. And so I think for me, trying to maintain those social connections with people has been very important. And I think that's also something that can be helpful to many people.
Just 1 second. Can you hear me okay?
Mhm.
Okay, thank you all. I want to switch over. There were some audio issues with my audio going in and out. So thank you all for the feedback. It sounds like a lot of good self-care and then also having compassion with other people. We heard some ideas around whether it's taking a walk or getting a bike ride or new hobbies, also being in touch with oneself and having an awareness around different feelings or emotions that you're dealing with. And also the importance of social connection throughout this. I think they're really great notes about how you yourself as the healthcare providers and experts in the healthcare profession are taking care of yourselves. And they also are very relevant to things that staff can be doing to help them cope, help them stay in tune with themselves, and also to pace themselves in this marathon called life. So for our next question, I'm going to pose this first to Jeff Littner and then second to Dr. Gregory Burns. As an employee assistance program counselor and as a primary care physician, you both come into contact with folks when they are first starting to begin to ask for help. So a big part of seeking help is even recognizing a need to do that. I'm wondering first from Jeff, could you speak to what is the most frequently asked question that you're getting at EAP? And Jeff, after you finish, I'll pose a question to Dr. Gregory Burns. So what are you hearing as people start to explore the possibility of wanting or needing help?
Sure, thank you for the question. EAP receives many types of calls from the 48,000 employees and the 52 departments that we serve. We receive calls that are both personal and organizational in nature. The most frequent question, though, is some version of how can EAP help? So for employees seeking individual counseling, we've got both the internal EAP counselors, and we address the work-related issues, and the external EAP counselors who handle personal problems. 6 sessions are available on both sides of the house, so to speak, and they're free of charge. First responders, specifically with fire, police, sheriff, they're available to have 10 sessions. But we also get calls from supervisors and managers, HR reps, and they may be asking about how to refer an employee to EAP. So we're going to provide them information and coaching on how to do that. And you could guess also with all those employees and the departments that frankly, sometimes bad things happen. And so if a critical incident does happen at work that affects one or many employees, then EAP is going to provide coaching to leadership on how to handle the aftermath of that traumatic event. And also we can provide group sessions for the affected employees. We also get phone calls from supervisors and managers trying to see how EAP can help with team cohesion and functioning. And we'll provide an initial consultation, and we may recommend coaching or direct service or even training or even mediation for that matter. So we kind of have a suite of services. And frankly, more recently, we've been receiving calls from employees who are concerned about systemic racism at work and violence within their communities. EAP has worked with our external vendor to provide support for employees to discuss personal and historical discrimination and how this has been affected within the work environment. And even, now that we're starting to get ready to return back to work in the ways that the departments are making their best effort to do that, we have been receiving calls from individuals and leadership concerned about safety at work. And, given COVID environment, understandably, employees are anxious about their potential exposure to COVID, their physical safety and the safety of the environment and that which is surrounding their work location. So, it would be nice if we were just getting one type of question, but we provide a lot of different services, frankly, across the city system. And so we get a lot of different questions. But what I've described is pretty part and parcel what has been happening over the last handful of months.
Thanks so much, Jeff. I think you raised a lot of really good points about the different places that you may meet people where they're at when they're ready to ask for help. There may be people who are very much adamant and know they want access to services. There may be supervising staff who are trying to offer support to others. And one thing I think about is when I first started in the county, I think about, and even honestly transitioning over to a new department in recent months. You get, our big handbook of maybe 200 pages, and you get a bunch of resources at one time. And oftentimes, or you think about orientation, there may be a lot of good resources that sound nice and that people have in the back of their mind that they can access. But as they get into the rhythm of day-to-day work, they forget, where to go or who to call. If you were thinking about sort of high level, what people should keep in mind about how to begin to access EAP, what advice would you give thinking of managers, thinking of staff in general about remembering where to go if you forget, who to call when you're ready to ask for help?
Well, probably the most simple way to find out who to call and how to do that would be to check into our website, sfhss.org, and then you'll see the EAP links. We obviously have 2 central phone numbers for employees to give us a call, but all the information is going to be on the website. And because again, people call, 48,000 employees, they're doing lots of different things and they have lots of different needs. And so on the website, they can plug into kind of the specifics of the services that we offer and what those next steps would look like.
Thank you, Jeff. I want to go to Dr. Gregory Burns to talk a bit more about identifying stress and anxiety. So Dr. Gregory Burns, what are some key behaviors you should look for or that you look for as a clinician when identifying stress or identifying anxiety in patients?
I think it's important to understand that when people come to me, oftentimes it's the minority of people who come in saying, I need to talk to you about my mental health. I mean, very few people do that. Maybe they might say have difficulty sleeping, et cetera. But oftentimes, either they're coming for a general checkup and they just happen to mention other things that are bothering them, physical symptoms, which I'll talk about in a moment, or sometimes they're just aware that something's wrong and they don't quite get it. And I think that's important to understand that depression, anxiety can manifest differently in everybody, right? And so oftentimes people are just kind of used to pushing through, and maybe they feel something, but they have too many responsibilities to really think about what's happening with their bodies. They've got their families, they've got their job, they've got, the kids to get off to school, financial worries, COVID worries, et cetera. And oftentimes we just stuff what we're feeling and just keep pushing through. And so people will oftentimes come to me with difficulty sleeping, uncontrolled worrying, and a lot of times physical symptoms. They may say, well, I've been having these headaches. I don't really know why I have headaches, right? Or I have neck pain, I have upset stomach, or, feeling like they can't take a deep breath. If all of those things, even musculoskeletal aches and pains, can be exacerbated or made worse when you're feeling stressed and anxious because of the physical tension that you feel in your body. All of those things can be depression and anxiety. And then I'll ask about different things like, how are you doing at work? How are you doing at home? Are there more interpersonal conflicts, with your family? You feel like you're more irritable, for instance, and short patience. During this time of the pandemic and even before, because there's still been a lot of stress even just before the pandemic, there's a lot more domestic violence. There's more elder abuse. There's more child abuse. So people are really on edge. And so asking about family dynamics is really, really important. Then there's a questionnaire that we offer in primary care to ask about, which I give out all day, every day, because a lot of my patients have been affected by these things. And we'll be asking about whether or not you've lost interest in doing things that used to be pleasurable to you, whether or not you feel hopeless or you've let other people down in your family, right? Whether or not you have poor appetite or overeating, difficulty concentrating, even thoughts about being better off dead, right? And sometimes people feel that way, even if they're not actively thinking about taking their life. People feel like, maybe I shouldn't be here. Why am I here, right? I'm not performing the way I want to, that I think I should be living up to, or I'm letting everybody else down, I'm not doing well at work. Sometimes all those feelings can make one feel like they would be better off not here. So again, getting a good history and understanding how people are functioning or not functioning, getting an objective questionnaire is helpful. Understanding and helping people make the connection between physical symptoms and emotional symptoms. Oftentimes people don't want you to just um, blow off or dismiss their physical symptoms as something that's related to anxiety, because they're very real to them, right? So whether it's something like, their stomach being upset, or what we might call irritable bowel, right? Or anxiety and feeling rushing heart rate or palpitations, all those things can be manifestations of anxiety, but everyone wants to feel heard, right? Everyone wants to feel like you are acknowledging, you're making sure that there are no physical symptoms that are causing, or really bad illnesses that are causing those symptoms, before you just brush them off. So it takes a lot of trust. It takes a lot of conversation to make sure that you are making the person in front of you feel welcome, encouraged to share their symptoms, acknowledge their concerns, make sure there's no physical illness that's really causing some of these things, and then get them the support that they need.
That's really helpful, Dr. Gregory Burns. I heard you mention there's so many things, like general awareness that it could be tight muscles, it could be your heart rate accelerating, it could be just not taking joy and things in life that you enjoyed. And there's so many different ways in which anxiety or stress show up. And that's when I know you've worked in equity as well, and working on Kaiser, so a health facility having anti-racist practices. So when we overlay different cultural experiences, economic experiences, if I'm a mom and I'm single, not that single means that you have to work harder than someone who's partnered, but if I have a really limited ability or time to say have free time to even invest in myself, if I have to work 2 or 3 jobs, how much time do I have to, like, it might be a sore back. My back is always sore. Headaches, I get those all the time. And it could be something that you get accustomed to. But I think you speak a lot to a lot of ways that as clinicians and as medical establishments, through practices like your assessments, you can help to be a champion for patients. And I know one thing that came up a lot when I worked in public health was this idea that oftentimes, especially in communities that have been marginalized, especially in communities that experience health disparities, you have to be your own best advocate. And I know we would love to think that I would speak for myself. It takes a collective. I think about the African proverb, it takes a village to raise a child. So it takes a village. We need people on every front and in every perspective. So definitely there's a sentiment that it shouldn't just be on the patient to say, this is what I need, or this is how I'm not missed. And it's helpful when you have clinicians who are proactive and aware of the full context of what people are dealing with. I'm curious, before we go to Dr. Shim, who'll talk a bit more about actually knowing when to seek help. When we think about this theme of being your own best advocate and thinking about all the different ways that stress and anxiety manifest and just meeting people where they are, do you have any tips for employees about how they can just be in touch with self, or be aware of when they essentially how to engage with providers and how to voice what they need when they are in those appointments? Because as you know, with sometimes the medical model or the appointments, there may not always be time to do the deep dive into what people are dealing with. And it may take some support outside of, a 15, 30-minute appointment window to really get what people need, as well as follow-up. So what advice could you give as we think about ourselves as being our best advocates for our health, in addition to our providers, working to do their due diligence?
Thank you. That's a great question. I help a lot of my family members with this kind of stuff as well. And so talking to them ahead of time about planning out what are your objectives for your visit, right? And oftentimes, as you just mentioned, there's a lot of angst or stress around even going to the visit. And so thinking through, what are your real core issues? What are your real concerns? What do you want as a good outcome for that visit in terms of the questions you want answered? Also kind of putting aside your angst. With one family member recently, there was just a lot of stress and anxiety about an injury and not knowing how that's going to affect their lives in the long run, right? Well, it's like, okay, let's put aside the angst for a moment, right? It's like when you're in that exam room, you need to be clear, because if you just, have a lot of anxiety about the story that you're telling, the provider may not hear what your real concerns are, right? And so sometimes just writing things down, talking through with a family member or a friend about what you want out of that visit, then making sure at the end of the visit, you actually recap, like, look, this is what I need from this, whether it might be, as Mr. Lintner was talking about, it might be, return to work questions, work safety questions that are causing the anxiety. We want to have those questions really answered. Or, maybe the conversation during the visit starts veering off in a different direction. Don't be afraid to say, I really want to make sure that I understand this particular symptom I'm worried about. I really want to make sure that we're getting to the bottom of this one that we talked about. What can we do to address that? And so I think trying to be as deliberate as possible and partner with your physician and let them know exactly what you want. And of course, the ideal is always having a long-term relationship with a primary care physician who can tell when something's off, right? When something's different, when your behavior is different, where your sleep is different, your relationships change, or there's an abrupt change in your job, then that person knows you and can know best how to help.
Thank you so much, Dr. Gregory Burns. I want to shift over to Dr. Shim, and then I'll have two questions and maybe open this up because I imagine Mr. Lintner may have some input on this as well. So Dr. Shim, we talked a bit about sort of recognizing signs of stress or anxiety. I wanted to ask you, everyone experiences some level of anxiety, but at what point should people know that they need to actually seek help? What have you seen from your work as a psychiatrist?
Yeah, I think it's a good point to just start out with that stress and anxiety are normal reactions. And we've had plenty to be stressed and anxious about in the last year. And I think, when it comes to mental health, seeking mental health treatment, there can be a lot of stigma, right? So people don't want to be labeled as crazy. And so there can be some hesitation. But I want to just make sure people understand that, we don't necessarily think about it as crazy, not crazy, is that, sometimes circumstances are that the issues you're facing are exceeding what your normal coping skills can deal with. That doesn't mean that, you're weak, that you're crazy, that you're somehow less than, but more that, the tools that you have normally are not enough to help you handle what you're facing. And so in that regard, it's perfectly fine to reach out and ask for help. And it could be to people like Dr. Gregory Burns or Mr. Lintner. I think it's important that the kind of help you seek feels comfortable to you. And so I think some of the signs and symptoms Dr. Gregory Burns talked about, they can range from emotional symptoms to actually somatic or body physical symptoms. But I think the key to think about is when does it cross over the line from a normal reaction to something that maybe you need that help. And that would be really, a distinct change in how you're functioning in your life. So it could be things like just the day-to-day things like you're not sleeping, or you're sleeping too much and you're having trouble getting out of bed to go to work in the morning or whenever it is that you go to work. It could be your appetite. So some people, when they're depressed and anxious, they lose their appetite and then there's weight loss, or the opposite could happen where they're eating for comfort and there's weight gain. So those kinds of changes, when they're significant, more than kind of what you see on a day-to-day basis, can be signs. And as Dr. Gregory Burns mentioned, it could be other symptoms like headaches, stomach pain, change in your bowel regimen, things like that are different, that are distinctly different than your normal self. You might also get feedback from others that you're acting differently, that you're more withdrawn, or perhaps you're more irritable and angry. You might find yourself getting into arguments with people where normally you're pretty, laid back. And then things like your relationships could be suffering as well. So with your family, your friends, your significant other, as well as at work. And then also a good measure of impairment in functioning is how you are doing at work. Are you going to work? Are you missing a lot of work because you can't get there because you're not feeling great? Are you not meeting the responsibilities that you have and the expectations? Has your supervisor talked to you? So those are also other signs that things aren't right with you, and that perhaps, you know, more attention needs to be paid. And then
Thank you so much, Dr.
Oh, I'm sorry. And just the other thing is, you know, your level of distress about how you're feeling can also be an indicator. So if you're really having a lot of preoccupation about how you're feeling, that you can't really concentrate or focus or really think about anything else, that's another sign that it's reached a level that's beyond what you can cope with on your own.
Thank you, Dr. Shim. I think you spoke to a lot of different ways, again, that the signal, the need to sort of knowing when it's time to seek help, that can really look different for each person. So it's not like a one size fits all to say this is when I need to seek help, and more that there's a collective of different experiences that may and what's changing for us, especially when thinking about feelings of distress, thinking about how our connections to people may have changed, and also just overall our mood and our livelihood, really. One thing you mentioned, I actually want to follow up on as a question, and I'll ask it to you and then to the group first. You mentioned hesitancy, and also you spoke to stigma. I think we were raising this earlier, this idea that, I mean, we could talk about this, the term crazy in and of itself, the way we stigmatize mental health illness, and how that's problematic. That can hinder people from even seeing signs or symptoms. That can hinder people from accessing help when they know they've seen signs or symptoms. It can also marginalize folks who are known to be living with mental health illness. We talked about how there are different experiences when people do access healthcare. So there could be different reasons, you know, how and why people don't come into healthcare for mental health support. I'm curious, I would love to hear from you, and then maybe Jess, and then Dr. Gregory Burns, about what do you think is the cause of hesitancy when you think about mental health and think about the different mental health support that staff need and that people need broadly? Why do you think there is hesitancy when it comes to accessing mental health support services?
Well, I mean, I think there can be a wide variety of reasons. I mean, I think the first thing that comes to mind is people tend to minimize how they're feeling. Like, oh, you know, I'm just having a bad day, you know, it'll go away. And really not want to actually think that there's a real problem, because that would lead to other things, right? Like, yeah, something's really wrong with me. I think time also. I don't have time to go see a therapist or get mental health treatment. I have so many responsibilities. I have to pick up the kids. I have to, you know, get dinner. I have to be at work, etc. So time can also be sort of an excuse or a barrier. And then, you know, depending on the person's background and culture, you know, mental illness can be very stigmatized. You know, this is not something that they can really talk about or admit to, or, you know, even acknowledge in themselves. And so I think, you know, their environment, their family, you know, people can also be quite discouraging of their loved ones seeking mental health treatment. And, you know, I encounter this all the time where medications also, you know, psychotropic medications used to treat anxiety and depression in some cases are really frowned upon, and also highly stigmatized as something that's terrible and bad. So I think, you know, family and friends can also be an influence. And then, as I said, the culture in which the person has been raised can also influence how they view mental illness and seeking help for it.
Thank you, Dr. Shim. Jeff, what do you think about that?
Yeah, well, yes, I agree. And I mean, there's gender reasons, there's generational reasons, right? There's cultural reasons. And even within the city system, you know, different departments have different cultures, as it were, right? And so that overarching expectation, I guess, I don't know, at least in the US, that whole pick yourself up by the bootstraps mentality, you know, it matters. And employees within some specific departments, you don't talk about your own personal stuff. And if you do that, you're kind of seen like, what, you're just supposed to suck it up and deal. And why are you talking about all of this? So it's not very well accepted. All that said, health service system, the department that EAP is in, we have a very strong champion network that is helping push and inform and develop the well-being and health benefits within the different departments. So that's one thing where we're trying to educate and make available to employees and frankly normalize taking care of yourself. And yes, this is Mental Health Awareness Month. And so health service system is also providing mental health first aid as a training for supervisors and managers, for leadership specifically, so that they can get some information, so that they can get a little more comfortable with this content, as it were, and some specific coaching on, well, okay, if you are concerned about one of your employees, how do you approach them? What do you say? How do you do that? Because people don't really know how to do that. And even though they may have the desire to reach out, or they feel like maybe even they should reach out, it's often anxiety producing to do that. So health service system has been trying to address that quite directly. And I am glad to say that those trainings are well attended. So, I'm hopeful, because the stigma is a barrier that is something that we have to address if people want to be able to take care of and feel comfortable in taking care of their mental health.
Really exciting to hear that progress and just different ways in which within our city-wide support services, there are tangible steps to really work on organizing around that hesitancy to make it easier for staff. I want to turn my question over to Dr. Gregory Burns to see if you had anything else to add when thinking about the hesitancy, some of the stigma, some of the barriers to accessing mental health care, even knowing that you need some type of support, even if it's not a formal mental health visit. What have you seen and what do you think is some of the cause of that hesitancy?
I'd like to echo both what Dr. Littner and Dr. Shim, Mr. Littner and Dr. Shim had already talked about in terms of not wanting to feel vulnerable, right? And we all kind of think, oh, just keep pushing through. It's difficult to identify, as we talked about before, whether or not there is actually a problem, because we're just so used to sucking it up. And I think it also in this culture, very much the, pull it up by your bootstraps and keep moving, just, get up, keep going. I think that doesn't allow for some real insight as to how we're doing on a day-by-day basis. And we get away from being mindful and checking in with our own feelings. And then also, as was mentioned, is also there's either sometimes there's an individual experience with the healthcare system that makes people hesitant about re-engaging, or culturally there's a hesitancy. And certainly in San Francisco, with our Asian American populations and subpopulations and our African American patients and Spanish speaking population as well from all over, there's a lot of hesitancy, right? And so sometimes it's cultural, sometimes it's religious also. People tend to fall back on religion or the religious institutions for support, as opposed to looking out to the medical community, which can be wonderful and very helpful, but then there's a limit to whether or not that's sufficient. As Dr. Shim was saying, when you really find that someone is not functioning, right, and there's a distinct change in their behaviors, the existing structure, maybe that's a religious institution or faith-based community, might not be enough. And so there's a lot of that fear of vulnerability, the fear of familiarity, and the lack of familiarity of actually going to sit down and talk to somebody. And then also there's a cultural mismatch. If you're talking to someone, a therapist, et cetera, who you think or perceive may not understand your history, your family's history, your family's coping mechanisms, et cetera, no one wants to go and be criticized, right, for their current practices, or it's harder to be vulnerable with what's going on in your life if you're concerned. So all of those are difficult and kind of cultural taboos. There's also cost, certainly within the Kaiser Permanente system. That's all part of your package in terms of EAP, with your health, with your work situation, that's always embedded. But if someone perceives that they need more care outside of that, and there's a cost to it, then that may be a concern. And someone mentioned time earlier. Yes, especially these days, it's really hard when people are really struggling just to keep their lives together. And access, right? And so, what is actually available and, how we can manage. So there's a lot of reasons for hesitancy. I talk to patients about this all the time. Encouraging them to get help and support, even sometimes just for 1 or 2 visits, sometimes just helps them reflect in a way that they hadn't thought about before, about how are they really functioning. They may think they're functioning well, but even just talking to somebody for a couple of visits can let them reflect and see, well, oh, I guess I really do need a little bit more support.
Thank you to all 3 of our panelists for those responses. They were really, really great. We have about 15 minutes left, so I do want to really quickly just send a reminder to everyone who's listening in, because we can't send the chat directly to panelists. If you do have more questions, if you did not have a chance to submit questions in advance, please be in contact with either DHR or HSS to share that information, and we can work on getting you the specific email addresses where you can voice questions. I myself did not submit questions, and through this conversation, more have arisen. So one thing I want to speak to, you all 3 touched on a lot of really good points, but one thing I heard consistently was the theme of culture. So how the social and the cultural, the structural context of who we are, what we bring to the table, how we interface with healthcare systems, the makeup of healthcare systems and practices, how that impacts mental health and how that impacts perception, how we engage with services. Earlier, I think Jeff spoke to this as well, that there, specifically within the city and county, there have been an increase of staff reaching out specifically because of concerns around racism, around stress related to racism. So I just want to, I'll share a little bit and then I'll turn it over to the panelists for an unplanned question. I'm really curious about this theme about culture and racism specifically as it intersects with mental health. And as we all probably know, there are many different ways in which that shows up. So for folks that maybe are Indigenous American, the long history of a genocide and this erasure of experience, maybe not having access either to schools or not seeing yourself reflected in healthcare systems, there's a history and a trauma of like the original insult, which in this case is like the genocide of Native folks in this country and throughout the Americas. Definitely with people of African descent or Black people, be they African American from the continent, from the Caribbean, but especially in the African American context, there's a very long history of racism, of oppression. There's just many different ways in which you can talk about how that's shown up. And while the conversations around anti-Black racism and organizations being anti-racist are a lot more novel in our organizations, for many of us who are Black, it's like we've been surviving this for years. Like I say this all the time. I remember when I mean, there's so many instances of police violence, for example. That's one factor. There also are different types of targeted violence in communities. So I think about when Nia Wilson was murdered at MacArthur BART, and I was like, I was a teenage girl there, and I caught BART there. I still catch BART there. I didn't know about this, and it feels like no one's talking about it, and no one sees me. Even just being super transparent, as recently as this Tuesday, in my neighborhood, there was a mass shooting on a bus, and that, if I'm being honest, that has been on my mind nonstop since Tuesday. Like, wow, a group of teenage Black girls had a bus shot into 70 times, and this is walking distance from where I live. I feel like anxious even driving in my neighborhood, and not to stigmatize my neighborhood. I love Oakland and where I'm from, but I recognize that for many Black folks, we've been living in this type of violence, both whether state sanctioned or in the community for a very long time and expected to show up to work like everything's okay. For many folks who are Latinx, whether they identify as Black or not, there's a very specific way in which xenophobia has played out. So we've literally had children in cages for years. Or there are times when maybe there are ICE raids that are very much targeting Latino folks, Latina folks, and that there's fear that may result from that for some communities. And then I think we also spoke to this too. There's been a rise in hate crimes that are targeting Asian and Pacific Islander communities, with a lot more the focus being East Asian folks. So there are staff who might feel like an increased concern, like, am I safe to go to work? Am I safe to come back? Am I safe to go outside? So there are all these ways in which racism, xenophobia, different forms of oppression, both from hundreds of years ago until now, and more recent, are shaping things like anxiety. They shape the stress that people have. Even our systems and how we talk about it, it shapes how people, like staff morale. So I guess I'm just curious from all the speakers, and this is a bigger question, but it's important that we have this, because really, if we're being realistic about where people are, we have to meet the whole person. I'm curious about what you feel could be priorities or opportunities when it comes to racial equity. And that can be in general how we serve folks who are dealing with racism, dealing with the impacts of surviving that. It can also be as systems, as we work to tailor our services and make sure we have culturally specific approaches I'm curious about what you think are opportunities, because this conversation around racial equity is interesting, because oftentimes we'll hear now more than ever. I always challenge that, like now as and always, like when has this not been a challenge? And it's okay if there's learning to be done, and I can understand how and why some people are sort of just now coming to the party, and it's like, let's keep that same energy and let's sustain it. So there are opportunities to really bring our best selves, really challenge ourselves in our very different areas of expertise. And to coordinate and learn from like a past history of folks who've been doing this work. So just want to kind of open that up to anyone who wants to start, and maybe we can hear from all the panelists. What are some opportunities do you think to advance racial equity through mental health, or through mental health practices, or even in how we tailor mental health services?
I'd like to take that. Since last year and the murder of George Floyd, Kaiser Permanente as a national organization has committed itself to being an anti-racist organization. And so there are a lot of things in terms of a lot of money poured into the community, and also trying to focus on education. Internally, there's a lot of work being done. And I know as Kaiser San Francisco, what we've done ever since then is really open up conversation. And a big part of it is last year focusing on safe space conversations, of creating different smaller venues, obviously all virtual last year, where people can talk. And it was, first of all, we had started in our adult family medicine department because of the impact of COVID and the stress that implied. Being able to have small spaces where EAP representatives could lead conversations and talk about those stressors. And then after the murder of George Floyd, we opened that up to different groups, because there are lots of different people with different lens on social injustice. And certainly we started off with our African-American community, to be able to have a safe space where we can talk about that, and talk about exactly what you were mentioning, of the daily trauma of people, being killed in the streets, and, police violence, and being historical, not a new subject, right? Where it was kind of new for everybody, but this was not new. This is an ongoing thing that all of us were experiencing, but this was a safe place where we could talk about it and process it. And that has gone on. And so we continue to have monthly meetings. Also, then we had, and this is before the current spate of violence against Asian Americans, but we had a whole series last year as well for our Asian American providers and frontline staff. And some of the things that we learned then was it was important just to have the conversations. Sometimes people would be on and they just wanted to listen. And one thing I learned is, again, somebody mentioned earlier, meeting people where they are. Sometimes people weren't ready to talk about it, but hearing that there was a safe space where people could have these conversations and perhaps engage in the future was really helpful. And we heard a lot of people even talk about, people talk about racism within their own families, and how maybe their parents had a lot of different biases that they learned to overcome by meeting their own friends, and so all of us hearing these stories helps to get to know each other better. And therefore, when you can understand people's stories and where they've come from and their journeys, what they've gone through, we can support each other. And certainly as healthcare workers of all kinds of different roles, we need to be present and okay with each other and with ourselves in order to take care of patients, which obviously during last year was quite chaotic. So we had many different venues, continuing medical education, and lots of safe space sessions. We had departmental sessions where people could talk about these things. And I think for the very first time, in 30 years of working, people could say the word race or racism without hesitancy. They couldn't, before, honestly, in different workshops, people couldn't even say it, which, obviously as an African-American woman, that kind of astounded me. But, you realize this is where people come from. We had book clubs, with White Fragility, and we had 500 people request the book. And so then we had, smaller book club discussions. And since that time, again, that was a wonderful prelude for what we're currently facing, which I'll explain what we've put in place in a moment. But we already had safe space sessions in place with this current spate of Asian American violence against Asian Americans. And so we've had a couple of different calls where we had, over 100 people on one call, and people were expressing, fear of their parents going out or even walking down certain streets, allowing their parents to go to the laundromat or to go to the grocery store. And when you And these are things that had not been openly discussed by our Asian American colleagues to the rest of the medical center, just culturally. But hearing, I think they felt a lot of the colleagues I have felt freedom in being able to express those things, right? And then the rest of us who were not Asian could understand better what they were going through and had been going through, including microaggressions. And one of the things we're rolling out is just more discussions about microaggressions. A lot of frontline staff get a lot of horrible things said to them by patients, etc., that we don't hear about necessarily. So how can we make sure that we are all aware of what each other are going through and therefore create systems to put into place? One of the things that we put into place is called the Equity Task Force, and is a leadership level task force with representation throughout the medical center, and really looking at how we can create a lens of equity through all of our operations. And a lot of that is, creating sessions for our frontline staff to be able to talk about microaggressions and what they have been going through. So they feel heard, which is really important. They feel it's a safe space. And then we can develop systems for that. We have lots of education on an ongoing basis about anything from unconscious bias to racial trauma, etc. So, we have lots of things in place, and really happy and excited with the momentum.
Thank you so much. It sounds like a lot of really excellent work and a lot of different ways in which you're advancing equity at Kaiser. I want to really quickly see if we can hear from Jewel and then Jeff on this question. And then we have maybe one last question, maybe two that were pre-submitted. But Jewel or Dr. Shim, what do you think about this question around racial equity and mental health in the intersection?
Yeah, so I mean, since I'm also at Kaiser Permanente along with Dr. Gregory Burns, I echo her comments about Kaiser's efforts to promote equity and diversity and inclusion. I think, just in terms of healthcare, we are acknowledging and trying to do a lot of hard work around healthcare disparities that are really becoming much more apparent in the last year with COVID, and for example, vaccine hesitancy among some of our patients of color. And so I think in terms of mental health, same thing, they're more hesitant to seek mental health treatment. They're more hesitant to acknowledge actually these issues, for all the reasons we talked about earlier. And so, and we're also aware that, those healthcare disparities exist in mental health as well. For example, the kinds of treatments that are offered to a person can be influenced by the patient's cultural and racial background. And, that's sad to say, but, those are the realities. And it's work that we're trying to undertake. I think the first thing is really recognizing that these disparities are there, and then trying to really meet them and fix them. And understand, again, the barriers to seeking mental health treatment among our patients of color.
And on the EAP side, if you don't mind me jumping right in, so I mean, we're a small but mighty team, and one of the reasons why the department, HSS, had established this external vendor contract was not only that given COVID and we were just frankly, overrun with all the requests and the concerns that people had, we needed the extra help. Also, what we did not want to do was to present and wanted to prevent any barriers of accessing service. And so the external vendor allowed us a larger pool of therapists that are more accurately going to represent the city employees. And, we've got a very, very diverse population within the city employee base. So we have worked with that external vendor to push them as well to expand the level of diversity within their provider panels, because there just simply are not enough African-American therapists or Asian therapists or Latinx therapists for that matter. There's just simply not enough. And, there's lots of reasons for that. And another effort that we have been trying to do, HSS specifically, to address this is to help, and this is one specific department, largest within the city system, to create what we would call a support session, a series of support sessions for individuals to be able to meet and talk about their cultural experience, frankly, of discrimination and racism, not only in their personal, but also historical and employment experience. And so that is running on a 6-week session, and they take 4 weeks off and then start another 6-week session. And we're trying to move that same model with another department, specifically around concerns of safety that have been problematic in many, many different environments. So, you know, there's a lot to be done, no kidding. And as a small but mighty team, we're trying to meet the challenge as best we can within the resources we have.
Thank you. So super exciting to hear that through our core healthcare agency across the county, there are very robust efforts happening to scale up the needs, and also very intentional efforts to support culturally specific wellness resources. And also through Kaiser Permanente, one of our biggest providers throughout the county, that there's a lot of work happening, both to support the Kaiser Permanente workforce and through the service provision. So we have just about 2 minutes left. So I'll pose one last closing question before closing out. With COVID, that's impacted all of our lives in a lot of different ways. There are some examples people raise, for example, like my kid and I are fighting more, and now they're just locking themselves in the room. Some people feel that their romantic partner has checked out of the relationship and we're fighting a lot more. Other people have voiced anxiety about returning to work and a fear for getting on public transportation. So COVID itself has induced a lot of different specific types of anxiety. So could you speak either to COVID or generally about how can our staff cope with the stress and anxiety they're feeling with all these different scenarios as COVID tends to evolve, as people are returning to school and work? Maybe just a quick top tip from all three panelists. What would you recommend when it comes to coping with stress and anxiety? And if it's okay, we can start with Dr. Shim and then Dr. Gregory Burns before closing out with Mr. Littner. So again, thinking about all the different ways COVID has exacerbated the mental health of the workforce, or the mental health challenges of the workforce, what are some ways that people can cope with stress and anxiety?
So, I mean, I would sort of advise, you know, similar to kind of what we all individually have talked about in our personal lives, is really, you know, the basics of taking care of your physical body. So getting enough sleep, eating well, regular exercise, those are the basics. And then I think also just having space for yourself to really be able to rejuvenate, to recharge, to unwind. It could be as little as 5 minutes a day with a meditation, some sort of wellness activity, anything that helps you, you know, relax and come back to yourself, I would really endorse.
Dr. Gregory Burns, could you share closing recommendations for coping and support mechanisms?
Sure, I echo what Dr. Shim has said, and then also I think providing grace. And sometimes when things are out of our control, we feel like we have to control everything that we have in front of us. Sometimes we can't do that, and so sometimes, you know, offering grace if your child is acting out, recognizing that they're under a lot of stress also, right? Or if we find ourselves being more irritable, kind of giving yourself a timeout, allowing yourself to have grace. And we talked about, Dr. Shim was mentioning some time away. I sent a list of resources that I think are going to either be put in the chat or sent out in a subsequent email of a lot of the resources that Kaiser Permanente offers through our health education department. Also, Kaiser Permanente members have free access to the Calm app for meditation, et cetera, during this time period. And there are lots of other suggestions on that list of resources to support oneself.
Yeah, and I'd have to finish by saying, you know, it is important to know that, as I would kind of more casually say, you know, we're here to tell the story. I mean, we have been making our way through, right? We have, for the vast majority of us, we do have the skills and capacities to see our way through, as we have been, and not to forget our own internal resources. So remember that we do have the capacity to make our way through, because we are doing that. Right now, we're doing that, and we'll likely continue to do that in the future. That said, like I said in the beginning, self-care, 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 self-care. And additionally, you know, just by extension, if you're so concerned about anything, well, reach out to somebody and talk about it. And if you happen to see somebody in a little bit of a tight spot, reach out to them and just check in and see how they're doing. Just that context and contact can make all the difference in the world. So I believe that those are all important aspects.
Those are all very important and very, very helpful. So I want to end with saying thank you to all three of our panelists. This conversation has been amazing. I can say personally, it's been a little therapeutic for me. So I appreciate HSS and DHR for inviting me to moderate today. I also want to thank all the city employees who are on the call. I did see a few emails and Teams chat and text messages come in from colleagues that I know. So I hope this has been helpful to all of you. Please feel free for our extended workforce to share the information that you found. And right now we're going to share a slide to showcase some resources, and this will be distributed virtually as well. So we can go ahead and share the slide now, and these lovely faces of squares will go away, but please feel free to share this information with your team, other colleagues across the department, and relay that information, because HSS is really doing a great job of providing a very full scope of services. Our providers have services. DHR is working to curate information to help staff across the county as well. So in closing, I will share this mental health slide with some resources for you all. And just a few notes to our employees on behalf of HSS and DHR. You play an important role to our city's recovery from this pandemic, and everyone has experienced greater stress and anxiety. So there's no shame in needing help. We all need help. Please feel free to reach out and take advantage of the benefits, the services, and the resources that are available to you. And for more information on resources available to you, you can visit the links that will be following on the slide. So there will be a repost of this event with captions tomorrow. So for staff who are not able to attend, we'll have the information virtually. And if we're not able to get the slide posted right now, because I know we're about 2.5 minutes over our time here, the HSS and DHR teams can share that later. And so Maggie, Carrie, do we want to share the slide, or are we going to close out here? So I think, okay, we might be having little technical difficulties, and we're 4 minutes over. So we're going to close on that note. So again, as Dr. Gregory Burns mentioned, as just Mr. Littner mentioned, there's a lot of resources that have been compiled. So please look out for that. And thank you. And we'll see you next time. And yes, all the best and take good care.
You bet. Thank you for having us on the call.
Thank you.